Welcome everyone to Health Science Anatomy. Today we'll go over Chapter 1, which covers the study of human anatomy. Anatomy is the study of the shape and structure of the organs in the human body. So basically, anatomists, they look at the shape and structure of these individual organs and what is the relationship between those parts and of as in an organ system, as well as the whole body. On the other hand, physiology is the study of the function of those organs and organ systems. So physiologists, they look at those things, the organs and the organ systems and the body, and how they function under normal circumstances. This is the study of physiology. On the other hand, abnormal circumstances, this is pathology. So you're going to hear this a very important idea throughout your study of anatomy and physiology, which is structure determines function. So in other words, the anatomy determines the physiology. That's why structure and function are inseparable. Today, actually in this class, we will focus on anatomy mainly, but in your future studies, you will understand and learn that anatomy and physiology are connected and intertwined with each other. So, with understanding those two things, those two different studies, and combining them, anatomy and physiology, it provides us with a good understanding of the organs, the organ systems, and the body. So the body levels of organization, from simplest to most complex. First, it starts with a bunch of atoms put together to make molecule, and the molecules are put together to make a macromolecule, and so on to make cells. So in other words, you put a bunch of chemicals together to make a single cell. You put now a bunch of cells together, you make a single tissue type. You put a bunch of tissues together and you make an organ. You put a bunch of organs together, you make an organ system. And finally, you put a bunch of organ systems together and you make an organism. So those are the levels of the body's organization. In this class, we'll study and go over 11 organ systems. This is just an overview, and the first one is the integumentary system, which is the skin and everything that covers our bodies from the outside and from the inside, the things that covers the tissue that covers our alimentary canal, for example. The next organ system we'll study is the skeletal system, followed by the muscular. So the skeletal system is basically the bones. The muscular system is in the name, muscles. The next one is the nervous system, so nervous tissue. Then we'll go over also the endocrine system, which is hormones, and we'll also go over the cardiovascular system, so that's heart and blood vessels and blood. We will also go over lymphatic, so this is your lymph. We will go over the respiratory system, lungs and breathing, then urinary system, digestive system, and the reproductive system, which is divided into male and female. Anatomists agreed on using a specific position to reference to the body and patients, and this position is known as the anatomic position or anatomical position if you've taken other classes. Anatomic and anatomical are interchangeable terms. So the anatomic position is basically can be seen in this picture of this guy. He is standing up straight, upright stance, and with the back not bent, not standing on four limbs, no, upright on two limbs, and the feet are parallel to each other and flat on the floor. The upper limbs at the side of the body and the thumbs are pointing laterally and away from the body, as well as the palms facing anteriorly. This term we will talk about later. It basically means the palms are facing to the front, and the head of the person should be leveled while the eyes are looking forward. Next, we will go over different planes that divide the body into different portions. So, first of all, we've got the frontal plane or coronal plane. It basically divides the body into anterior and posterior portion. So anterior means front, posterior means back. Next, we've got the transverse plane, and this plane divides the body into superior and inferior. So basically, up and down. And finally, we've got the sagittal plane, which divides the body into right and left. And all this information that I just talked about are found on the next slide. So if we go to this one, we can look at examples of the frontal plane right here in picture B, dividing the lungs basically into anterior and posterior portion, not just the lungs, the heart too. We can see it right here in this picture. On the other hand, we have the transverse or horizontal plane, which is found and can be seen in picture C, which divides the skull in this example and the brain into superior and inferior portion. Finally, as I mentioned, the sagittal plane divides the body into right and left, and we've got the example of that in picture A. This is a sagittal cut of the pelvic region of the female body. So also we've got two different sagittal planes. So we've got the median or the mid-sagittal plane, which is basically dividing the body into equal halves. On the other hand, the parasagittal plane divides the body to right and left in unequal portions. I would say that the main things to focus on are the main planes, so the frontal or coronal plane, the transverse or horizontal plane, sorry, that was a weird line, and finally the sagittal plane. Next, we will go over terms, very, very important terms for your future studies, and if you go on to, let's say, nursing, PT school, PA, medicine, in the medical field, you want to be a physician, all of these fields will require you to learn and know these terms just like you know your last name. And the first one, we have the anterior, which, as I mentioned, it means toward the front of the body. On the other hand, the opposite of the anterior is posterior, which refers to the back of the body. So examples right here, we have the sternum, for example, is anterior to the heart, and the esophagus is posterior to the trachea. So in other words, the sternum is basically right in front of the heart, while the esophagus is posterior or is behind the trachea. We also got ventral and dorsal. So ventral is another way to describe the anterior side, and dorsal is a way to describe the posterior side. Those are used so anteriorly and ventral, those are used interchangeably, while the posterior and dorsal are also used interchangeably. Mainly, I would say that anterior and posterior are used for humans, while ventral and dorsal are used for animals and in the veterinary medicine. But it's important to know all these terms, of course, and you better expect all these terms actually to be that you guys will be tested on them during the exams. I'm not gonna put all of them on the exam, but some of them, so please know them very well. Next we've got the superior and inferior. So superior means above, and inferior means below. So an example of that is, can be found right here. The heart is superior to the diaphragm, so the heart is above the diaphragm, while the liver is inferior to the diaphragm, so the liver is below the diaphragm. Next we've got cephalic, and cephalic means toward the head or the superior end of the body. Cephalic means head, and on the other hand, rostral means toward the forehead or the nose. So the forebrain is rostral to the brainstem. You don't really hear the term rostral a whole lot used, but I guess it's important to know. Then next we've got caudal, which means toward the tail or the inferior end of the body. So right here, caudal, and an example of that is the spinal cord is caudal to the brain. So the spinal cord is closer to the inferior end of the body than compared to the brain. And finally, we've got, at least finally on this slide, we've got medial. Medial means towards the midline or the midsection of the body. So the heart is medial to the lungs. So basically the heart is in the middle of the body and the lungs are to the side. The opposite of medial, and as I mentioned, toward the midline of the body is lateral, which means away from the midline of the body. So the eyes are lateral to the nose in the example we have right here. Next we've got proximal, and that means it's closer to the attachment or origin point, and mainly this is used for the limbs. So right here we've got the term proximal and distal. Those two terms are used for limbs. So as you see in the example right here, the elbow is proximal to the wrist. So the elbow is closer to the point of attachment or origin to the midsection of the body than the wrist. On the other hand, the word distal means further from the point of attachment. So the fingernails are distal, are on the distal end of the fingers. I'll give you a better example, and that would be the radius is distal to the humerus. So next we've got a few other terms. Ipsilateral, which means on the same side of the body, so right or left, then contralateral, which means on the opposite side of the body. So we've got some examples right there too. Then the final two terms are superficial and deep. So superficial means closer to the surface of the body. So the skin is superficial to the muscles. So the skin is basically on top of the muscles. And the word deep is the opposite of superficial. So we have the bones, for example, they are deeper to the muscles. And again, deep means further from the body surface. So we also got a couple of terms down here, which means prone, that means lying face down, and supine means lying face up. Think about supine like holding a bowl of soup, I guess, with the palm of your hand, and prone is when the palm of your hand is facing downward, basically, and laying face down. Right here we got some examples of those terms. So right here we've got distal and proximal, and we've got lateral right here, so lateral, and medial too. We've got superior and inferior right here, and those are some very important terms that we're going to use throughout the semester. So right here we've got examples of the anatomical position from an anterior or ventral view of the female body in picture A and the male body in picture B. And in this slide we also have examples of the anatomical position, but this time from a posterior view or dorsal view. Picture C is for the female body and picture D is the male body. So the human body is proportioned into two main regions. First one is the axial region, which includes the head, the neck, the trunk, and basically this is the main vertical axis of the body. The other region is the appendicular region. When you hear this word, think of appendages, and this is basically composed of the upper and lower limbs. Next, we have different cavities in the human body. So right here, we have the cranial cavity, and this one is formed by the cranial bones, and it contains the brain. On the other hand, we have the vertebral canal, and this one is formed by the vertebral column and the vertebrae, and those house the spinal cord as well as the beginning of the spinal nerves. So right here we look at picture A. We have a sagittal view of the human body. So we have right here an example of the cranial cavity. On the other hand, right here is the vertebral canal. Next, we have the thoracic cavity, and we have an anterior view of that in picture B. So the thoracic cavity is an interesting cavity. It has three cavities actually within it. So the thoracic cavity is basically the chest, and it contains the pleural, the pericardial cavities and the mediastinum. Pleural cavity is the space between the layers of the pleura and that surrounds the lungs, and the pericardial cavity is the space between the layers of the pericardium that surrounds the heart. So when you hear the word cardia, think of cardiology or the study of the heart, so cardiac. And mediastinum is the central portion of the thoracic cavity. We'll go over this more in details and just a little bit. Then we've got the abdominopelvic cavity, which is divided into abdominal cavity and the pelvic cavity. So, first of all, the body cavities and membranes are divided into posterior and dorsal cavities. The first one is the cranial cavity, which, as I mentioned, it's enclosed by the cranium, so the brain case or the bones of the skull, and this one houses the brain. The ventral canal is enclosed by the vertebral column, and that's the backbone or the spine, and it houses the spinal cord. Next we have the ventral or anterior cavity, and this is we have the thoracic cavity and the abdominopelvic cavity. Those two are separated by the diaphragm muscle. So the thoracic cavity, right here, it houses multiple different cavities, and we'll go over that into more details. And as I mentioned earlier, the abdominopelvic cavity houses the abdominal cavity and the pelvic cavity too. So body cavities are, once again, they are posterior / dorsal cavity, thoracic cavity, and abdominopelvic cavity. Those cavities are lined up by lined up with serous membranes, and those membranes are extremely important because they keep those organs inside those cavities from rubbing against the wall of those cavities. Something very, very important in anatomy, it's friction is always bad in the human body, or I guess, body in general, even animals, if you're into veterinary science. So when you have organs rubbing on the cavity walls, that's going to be very bad, and it's going to cause lesions and bleeding. So we don't want that. Friction is always bad, and think about it like in arthritis. It's basically the degeneration of the cartilage tissue, and now we've got bone on bone rubbing against each other. There's friction, and that's going to cause a whole lot of issues. The same thing and the same idea applies for the those body cavities. We want serous membranes, which are continuous layers of cells. They cover those cavities and cover those organs to protect them from friction. So now let's examine these serous membranes, which are composed of two layers, the parietal layer and the visceral layer. So when you hear the word visceral, think of the viscera right here. So first of all, the parietal layer, it lines up the internal surface of the body walls or the cavity. So this layer sticks on the inside of the cavity. On the other hand, we've got the visceral layer, which covers the external surface of the organs. So the visceral layer covers the organs from the outside, and this layer, as it again houses the viscera. So uh, the viscera is within this cavity or within this layer. Between those two layers of the membrane, we have sometimes a potential space known as the serous cavity, and also we have something very, very important that those membranes secrete, which is serous fluid right here. This is basically a liquid that's basically like an oil in a car or in a vehicle. It serves as a lubricant. It lubricates those two layers so they don't rub against each other. Also, so these layers don't rub in the case of the parietal layer against the cavity walls, and in the case of the visceral layer, so they don't rub on the viscera or on the organs. Again, all of this to reduce friction. Again, friction is really bad in the body. Our organs inside our bodies, they move all the time, and you've got your heart pumping all the time, lungs, breathing all the time, your viscera, the alimentary canal, such as the large intestines, the small intestines, even when you're not eating, they are moving and they are having they're making movement. So it's quite interesting. And if there isn't these layers and there isn't this fluid, then as I mentioned earlier, a whole lot of problems would be caused. The viscera would get damaged a lot faster, and we'll have a lot of problems and bleeding. So the goal of the serous fluid is to reduce friction caused by the movement of these organs. Let's go over some examples of the serous membrane. The first one is the serous pericardium. So when you see the word cardia or cardi, that means heart. So the serous pericardium is a two-layered serous membrane that covers and surrounds the heart. This two-layer is we have first the parietal pericardium, which is the outer layer, which forms the sac around the heart, and under that, or deep to that, I should say, we got the visceral pericardium. So the inner layer that forms the heart's external surface, and it's the layer that's directly covers the heart. So you can think of it as you've got the heart, then the visceral layer, then the visceral layer is covered by the parietal layer. Between the parietal and visceral layer, we have the pericardial cavity, and this is the space that contains the serous fluid. And again, the goal of that to reduce friction. So another cavity is the thoracic cavity, and it houses the pleural cavity, the mediastinum, and the pericardial cavity. So the mediastinum is the median space in the thoracic cavity. It contains the heart, thymus, esophagus, trachea, and major blood vessels that connect to the heart. It does not contain the lungs. Very, very important. It doesn't contain the lungs. The mediastinum, right here in the picture, you can see it. It's this cavity in the middle. It's just in the middle of the thoracic cavity. Next, we've got the pleura, which is a two-layered serous membrane that is associated with the lungs and surrounds the lungs. So we've got the parietal and the visceral pleura. So the parietal is the outer layer, which lines the internal surface of the thoracic walls, and the visceral pleura is the inner layer, which covers the external surface of the lungs. So once again, we've got the visceral pleura surrounding the lungs, and the parietal pleura. It's the layer that's on top of the cavity walls. And also we've got the pleural cavity, which is the cavity between the parietal and visceral layer, containing the serous fluid, which reduces friction. And this cavity is very, very important, the pleural cavity, because it maintains pressure also in the lungs. So once again, this is a picture looking at the thoracic cavity and the different cavities within it. Next, we have the peritoneum, which is a two-layered serous membrane, again, serous membrane, lining now the abdominopelvic cavity. So we've got the parietal and visceral layer of the peritoneum. So the parietal layer is the outer layer that lines up and covers the internal walls of the abdominopelvic cavity. And now we also have the visceral layer, which is the inner layer that covers the external surface of the abdominal and pelvic organs, most of them. And we have as well the peritoneal cavity, which is the potential space between the parietal and visceral layer, containing the fluid. And this fluid, once again, is to decrease friction, and it's basically a lubricant in as we have seen throughout this serous membrane. Next, we have right here, what type of plane is this? Can you tell me? Think about it quick. This is a sagittal cut of the, or sagittal plane of the male body. So this is you could get pictures such as this during the exam, and I would ask you, hey, name this plane. What plane is this? So right here we have different ways that the anatomists divide the abdominal region. And let's focus on the upper pictures, where the abdominal is divided into 4 different quadrants. So we've got the right upper quadrant, left upper quadrant, right lower quadrant, and left lower quadrant. The reason this is important is we have an understanding. If a patient comes to the ER, we are able to locate where the pain using a reference point, and the reference point usually is the umbilicus. So from the umbilicus, there is 2 lines drawn vertically and horizontally, and as a result, you divide the abdominal region as 4 quadrants. So The right upper quadrant, this region has some important organs in it, such as the liver and gallbladder. In the left upper quadrant, there is the stomach and spleen and a few other organs too. Both in the upper quadrants, you have part of the duodenum and the transverse colon. Now moving on to the lower quadrants, the first one is the right lower quadrant, which has the appendix, ascending colon, and a few other organs. Then the left lower quadrant has the descending colon and sigmoid colon as well. Both lower quadrants have the small intestines, the large intestines, kidneys. It's a bilateral organ. We also have the urinary bladder and the reproductive organs. So these have, again, very important clinical applications because it's very important for you to understand if a patient is presented to you again in the ER, then you need to know where is this pain. If they say it's in the right lower quadrant, then there is it wouldn't be a bad idea to suspect that there might be an appendix problem, and whether the pain is located in a certain quadrant, this can mean the situation could be urgent or non-urgent. Then in the lower picture you have another way to break down the abdominal region or divide it, and right here there are 9 different ways to do it. So in the middle square, or in the middle region, it's called the umbilical region, and above it you have so this is the umbilical region. Above it you have the epigastric region. Epi means above, gastric means stomach, so it's basically the region above the stomach. And you also have the hypogastric region, which is the region in the middle, and it's below the stomach. Hypo below means, and gastric means stomach, so below the stomach. You also have right here also a few other regions, and those are located both on the right and the left. I know in this picture you can only see it on the right, but it's also on the left side. So the right upper region or the left upper region is called the right or left hypochondritic region. Hypochondritic means below the rib, so it's the region below the ribs. Then you've got the lumbar region, which is in reference to the lumbar vertebrae. Then also you've got the inguinal region, which is in reference to the inguinal ligament. So those regions again are both on the right and left. So for example, you got right and left lumbar region, then you've got right and left inguinal region that the anatomists use to divide the different regions in the abdominal. Finally, we'll go over some medical terminology. We have eponyms, which are terms that contain people's names, such as Alzheimer, Cushing disease, Crohn's disease. Those are named after the scientist that made the diagnosis or the discovery. We also have scientific terms such as the root, which is the core meaning of the term. An example of that, we said cardia and pericardium. Cardia is the root or the core of the term. We have vowels that we combine with the roots, and you combine prefixes and suffixes as well. So prefixes are things that modify the root and they are added at the beginning of the word. Suffixes also modify the root, and they are added at the end of the word. So once again, to our example, pericardium, peri is the suffix, cardia is the root, and is the or the is the suffix. So pericardium. Finally, we have the acronyms, and those are words made of first letters of a series of words. An example of that is ACL, or anterior cruciate ligament. Another example is in the heart is the RA, the RV, the LA, and the LV, which are the respectively the right atrium, the right ventricle, the left atrium, the left ventricle. So know that we're going to use these roots and acronyms and eponyms throughout the semester. Thank you, and hopefully you had a good understanding of the first chapter. If you have any questions, don't hesitate to let me know, and I will see you again in chapter 2. Take care.